Welcome to this session of MD310, Medical Care Provider, Taking a Medical History. By the end of this session, you'll be able to name the 8 elements of a complete medical history, perform an 8-point medical history on a patient, and name 3 items that are important in a trauma history that may not be important in a medical history. So why do we take medical histories? Well, medical histories are there to figure out what's going on with your patient. In fact, for many illnesses and injuries, the medical history tells you everything you need to know to figure out what's going on and what you need to do to treat the patient. Now, in your working environment, you're going to have to do a focused medical history. This is not a visit to a primary care office with no complaints for a general history and physical. There's something going on. That's why you're performing this history. And so you can typically get about 90% of what you need to know to figure out what's going on, and then your exam gives you the last 10%. Sometimes some lab tests or other things will help as well. So any patient that presents to you for medical care needs a history. It's going to be much easier if the patient is responsive, but sometimes you'll be responding to take care of somebody who's unresponsive. And if that's the case, you need to ask the people around them what happened. You need to look at the environment to see if there's signs of what may have happened. If it looks like the patient fell, can you look up and see blood spots on a bulkhead that tell you how far they fell? Some patients will have medical alert tags, things that they wear around their wrist or neck that tell you something about their medical history. And those are there usually to give information if the patient is unresponsive. So a wrist medical alert tag that says diabetic in an unresponsive patient makes you think that they're having a problem with their diabetes. Finally, for some patients, you'll have old medical records that you can look at. These are the 8 points of a complete medical history. And again, in your environment, your history will tend to be focused. So some of these things you're only going to ask about if they're relevant. A chief complaint you'll always want to know, because you want to know why the person is asking you to help them. History of present illness is also important in every patient so that you know what's going on regarding the chief complaint. A review of systems may be important. The past medical history may be important, or it may not, depending on what's going on. Allergies are always important. Medications the patients are on may be relevant or may not, but you'll always want to check those. And a family and social history may or may not be relevant. We'll talk more about those too. So the chief complaint is why that person is coming to you. You record it in the patient's own words when possible, and those words give you a clear picture of what the patient thinks is going on. It guides the rest of what you do. Again, in your emergency care environment, you're going to do focused history and physicals, and your assessment and plan should relate to the chief complaint. If someone's complaining of a sore throat, it's very unlikely that your plan will be ACE wrapped to the ankle with ice as needed for ankle sprain. So make sure that the chief complaint is relevant to what you actually end up doing for the patient. In trauma patients, you need to make sure that the chief complaint is due to trauma. If someone comes to you and says, I have back pain, and you put that in quotes as their chief complaint, it's very important to distinguish. Do they have back pain because they fell off a ladder? Or did they wake up with terrible back pain? Because those can be very, very different causes if there was no trauma versus if there was trauma. Now, the history of present illness really fleshes out and gives a much better description of the chief complaint. So it describes what led up to the chief complaint, what things are related to the chief complaint. There can be short and long-term relevant historical information, and you really record in this place all the information the patient gives you regarding the event. When it's relevant, you'll want to know when the patient's last meal was eaten, and that has some significant implications for surgeries or for causes of some types of pain. When you're documenting your history of present illness, you start with the age and gender. So you've got a patient with a chief complaint of chest pain. You note that it's traumatic. And the HPI would read, Mr. Albertson is a 24-year-old male who was struck in the left chest with a packing crate that shifted and fell onto him. And that gives you a picture of both who the patient is and exactly what happened that led to that chief complaint. We'll talk a little bit more about documentation later, but where you put information is important. So for trauma patients, you want to include what's called the mechanism of injury, which is a description of how the injury occurred. And unless you witnessed it, someone else is telling you this, so it's subjective information. That is not something you see with your own eyes or objective information. Typically, as you're viewing the scene, you would document this information in the history of present illness. So if you see that the balcony that he fell from was a 2-story balcony, and you can visibly see that, you would document that typically under the history of present illness. Now, part of your history of present illness includes something called a review of systems, and there are 14 recognized systems. You don't need to review them all, but you want to review ones that are relevant to the patient's chief complaint. So if a patient is complaining of chest pain and shortness of breath, you may, and they don't mention this, you may ask, have you had any weight changes? A significant decrease in weight might suggest cancer or an infectious disease like tuberculosis. A significant increase in weight might suggest heart failure and fluid retention. And the patient may not bring this up without you asking specifically. These are the 14 recognized body systems, quote unquote. Constitutional, you'll usually check as general, how people generally feel. HENT is head, eyes, ears, nose, and throat. Eyes are often considered separate from this. Cardiovascular and respiratory, as well as gastrointestinal and genitourinary, things related to the kidneys, urination, and reproductive organs. Those are often relevant in medical histories. Musculoskeletal is often important in trauma. Tegumentary is skin. That's often important when you're talking to someone about a medical condition. Psychiatric, you'll probably only focus on if they have a psychiatric complaint, like I'm depressed or I want to kill myself. Neurologic is going to be important in checking to make sure that they've got normal neurologic function, both in medical and traumatic complaints. And it's very unlikely that you will ever need to assess hematologic and lymphatic, immunologic and allergic, or endocrine review of systems. Although hematologic, you may ask for someone with chest pain. And when we talk about chest pain in that session, you can see how the hematologic system relates. Now remember, in your role, you're often gathering information that gets transmitted to medical control or someone else with more training so that they can make relevant decisions about what's going on. So you want to, when you obtain what's called their past medical history, get a list of all prior or current diagnoses and just gather the information. Don't judge whether it's important or not. If someone has a childhood history of chickenpox and they're complaining of severe chest pain, and on your exam you find a rash, that's incredibly important to your medical control provider so that they can determine that the patient has shingles. That may not be relevant to you when you're thinking about it initially, but it is relevant for medical control. So get that information. List all prior surgeries the patient has had, and then you can decide when you're listing to put down active or not active. So someone who had childhood asthma who's had no trouble with, that's not currently active, but someone with high blood pressure taking medications, that's active. You can put tobacco and alcohol abuse into this section. You don't necessarily need to divide out a social history for billing reasons, so if you put this directly into this section, that is important medical information and part of the patient's medical history. You also always want to record any patient allergies. And this is not just a listing of things the patient says they're allergic to, but it's an understanding of what happens when they take them. So we include allergies, intolerances, and adverse reactions to medications, food, or environmental things like pollen or mold. And make sure you list what the reaction was. If I have a patient who's got crushing chest pain, and I'm worried they're having a heart attack, and they tell me that they're allergic to aspirin, I need to clarify, when they took the aspirin, did they have rash and trouble breathing? If they did, that's a true allergic reaction, and we're not going to give them aspirin because it could kill them. If it caused nausea, that's a mild intolerance, and they certainly can take the aspirin, and if they need something for nausea, that can be treated as well. And if they say that they never had a reaction to it, but they have a history of an ulcer and they were told not to take it, a single dose of aspirin in the setting of a heart attack is not going to hurt that ulcer, and it decreases their chance of death by 50%. So that patient we would want them to take. So make sure you know exactly what the so-called allergic reaction was. You also want to know every substance that a patient is taking. And so this is a general term, medications is a general term for administered therapeutic agents, medications, herbals, supplements, and vitamins. And you can put in substances of abuse here, or you can put them in under the social history if they're relevant. You want any current or anything that the patient recently stopped taking. And if you're dealing with children, which hopefully you won't have to often, make sure you record whether or not their immunizations are up to date. And the expectation is not that you would know which immunizations they should have had and go through those, but ask their parents, are the immunizations up to date, and they'll give you that information. For trauma patients, it's very important to ask the date of their last tetanus shot. People in the industry should be up to date on tetanus, but not everyone will. And if you're rendering assistance to a vessel in distress that's a civilian vessel and there are injuries there, people may or may not be up to date on their tetanus. And then ask if the patient is on any blood thinners. This is very, very important. There's lots of different blood thinners, and they cause havoc in trauma. So make sure that you ask if somebody's taking any. A family and the social history may also be obtained. The family history is anything that runs in the family that's relevant to the chief complaint. So somebody has a fall and hits their head, and there's a strong family history of hemophilia, you would worry about their chances of bleeding. The social history is really limited to, it can be incredibly broad, but it's really typically limited to things that are relevant. And what's most important to you is going to be whether they use tobacco, alcohol, or drugs, and what their role is, their occupation, their specific job duties are shipboard, because that may be relevant to their chief complaint. So how do you remember all of this? Well, there's a mnemonic called the sample history. Sample is symptoms, their chief complaint, their history of present illness, and the review of systems. The A is allergies. The M is medications. The P is past medical history, which includes family history and social history. L is the last meal, and that's part of the history of present illness. And that's important if someone has trauma or they may need to go to surgery, and so you want to know when they've last eaten. It's also important if they're having abdominal pain, and every time they eat, the pain in their right upper quadrant gets worse. That's important information for medical control. And then E is events leading up to the complaint, which is part of your history of present illness. When you document, you'll document using something called a SOAP note. And everything we've talked about in the history falls under the subjective section. So SOAP stands for subjective, objective, assessment, and plan. Subjective is the information that's given to you by someone else that you cannot directly verify with your own senses or measuring devices. And so that includes your chief complaint, history of present illness, review of systems, past medical history, medications, allergies, family history, and social history. Objective would be what you find on your evaluation. Assessment is what you think is going on, and plan is what you are going to do or what you did to take care of the patient. Next, we'll go through a knowledge assessment to make sure that this material is clear to you.